possibility of further surgery, then breast conservation surgery could be an option. Okay. Now, just to mention here types of mastectomy for those who already know, but as to share with you. Now, the conventional mastectomy is where you have the breast. Is a conventional or traditional mastectomy where you have the whole breast removed, okay? And then you also have the skin sparing mastectomy where you save the skin. You save the skin, but often than not, the nipple complex may need to be removed. Okay, when you can save the skin, save the skin along with the nipple areola complex, then we tend to use the terminology simultaneous mastectomy. Expired. Now this is how a patient with left mastectomy looks. With breast, no breast. It's just flat line. Okay? Now this is for someone who has undergone bilateral mastectomy.
Maybe Prof tak pakai mic kot.
Tak pakai mic.
Tak, pasal kadang tepat tak dengar. Tak payah. Nanti dia repair.
Hello. Okay. Okay, so time bomb. How many seconds we got left?
Dok, saya cakap dok pakai tak pakai tu. Boleh tak? Tapi dia pakai tu. Dia batuk. Oh, I see. Think of this.
Any questions so far? We can take questions while this gets in a good mood. Okay. Maybe we can move on. Yeah? Okay. Right. Alright, so just look at this and imagine how patients feel. For those who have to undergo a mastectomy, unilateral or bilateral? Okay, now I'd just like to touch on those who have undergone mastectomies. It is advisable for them to use external prostheses when they are erect. Okay? Meaning that the balance is now gone, the alignment. Because one side has a breast, so that remains heavy, and the one without a breast is light. So if you look from the back, this is with two breasts, this is with a left mastectomy, post-left mastectomy, right mastectomy. Post-right mastectomy. So, dramatic sound effects. Dolphin. Whale mating season. Okay, so this is heavy with the breast, right? Normal breast. This is now without a breast. So when you are without a breast, that is light. So the one with the breast will sag down.
Oh,
okay. Because now there's like no more breast. So because there's no more breast, so now the alignment of the back and the spine is no longer straight. Okay. So in the long term, this person will end up with
chronic back pain. It will affect the posture. Prof, saya tanya sikit yang dok kata tu yang dia affect our backbone. If the breast is not that big, do we still have to wear prosthesis?
If it's just a smallish breast,
Yeah.
even a smallish breast can weigh about 250 grams. If you're talking about no breast at all, there are some women no breast at all, they just have nipples. Then it's a different scenario. And you just there are some in Malaysia, the Chinese tend to have smaller breasts, and some of them they're really hardly any breast tissue. So it's just you can see the nipple, but it's completely flat. Then that's probably alright. Okay.
Sejak.
So in that scenario, post-mastectomy, normally I advise that patients should wear an external prosthesis fitted into the bra. Okay? Now there are some women, say housewives for example, or quite older ladies, they say, you know, I don't wear any tight-fitting clothing, I don't wear bikinis, I don't wear anything glamorous, I'm just in my nightgown most of the time. Do I need to wear it? Okay, the advice is yes, as long as you're erect. If you're lying down, then God forbid, but if you're bedridden, then it's a different story. But if, as long as you're upright, then you should generally be advised and be wearing an external prosthesis in a bra to prevent this problem. The problem is, if you have a lady who's had previous breast cancer and she comes to the clinic complaining of chronic back pain, one of the things that goes through your mind is whether she's got spread of the cancer to the bone. And you will be subjecting this lady to bone scans and other x-rays and stuff because you're worried about that. Okay, so that will increase anxiety not only in the patient, in her family, in you. So this is a preventable thing, a simple thing but preventable. So why not do it? Okay. Okay. I'd like to touch a bit on breast reconstruction. So basically, whether it should be immediate versus delayed, right? More often than not, we would advise immediate because in the long run, immediate reconstruction produces better results cosmetically. Okay? Also, it means that you can have the patient wake up with something there. And I think that is mentally or psychologically something very important because they don't have to go through the period where there's a loss. You know, they wake up with something different, so they look different, and that can be a big setback to some women. So if you are able to perform, or the patient is agreeable, the patient is suitable for immediate reconstruction, I think that handles this problem. Okay, so they wake up, they have something, it will be different, but at least they have something compared to waking up with nothing, right? Right. Types of the flaps that we use will be tram, which you may have heard of, versus LD. Tram is a very long word, right? Transversus, rectus, abdominis, myocutaneous. So it's a bit of a mouthful. So normally you might get a bit breathless by the time you finish that. So we just stick to tram. LD is latissimus dorsi. Okay, this is the back muscle, this is the tummy muscle. Okay. Now, this lady on the right has had a traditional mastectomy. Okay, traditional mastectomy and had a delayed can be either delayed or it's an immediate reconstruction. More often than not, this is a delay. So as you can see, the muscle was taken from the tummy here and brought up to create a new breast. However, as you can see, it's like a patchwork. It's like a patchwork. Okay, you can see the scars, and you know it's different from the opposite side. Over clothing, probably it doesn't make much difference, but when she undresses, there is a difference. Okay, but if you compare, this is probably still better than one with and one without. Yeah. Okay. Now this is another lady who has had asymmetry in size. Okay, so she's also had a tramp taken. This is a tummy muscle, a tummy scar, which is very long from here right to the other end. All right, so this has been brought up. We should be to the left. So this skin is from the tummy, the skin and the muscle. Now, it is a long scar. Now, one of the side effects is you can get a hernia. This lady is not fat. She's okay, average size, but the thing bulges because now the strength of the abdominal wall is gone. So the muscles which were initially there are gone. So they are the ones that keep the intestines behind. So you've taken them away so the intestines can protrude out. So they can protrude out, and this is your skin. So this is a hernia which can happen after your tram flap reconstruction. Okay.
Prof, will that be causing any pain to the patient?
It may not be pain, but
appearance, isn't it?
I mean, it can be uncomfortable. So this lady will probably undergo some repair. You can put a hernia repair, or sometimes you can use a corset. But that will have to be a lifelong, lifelong habit or advice. Okay. Now, so this is tram flap reconstruction. They take the muscle. So this is how a mesh looks like. This is the mesh. This is like a net. So once they take the muscle away, so they put this over the defect to try and sort of build a new wall to keep the intestines behind. Okay, this is a mesh, which is normally used in hernia repair. Now, more often than not, it works. It's not a guarantee. More often than not, it works. So you're trying to overcome the problem of a hernia, which can develop after surgery. Okay? But that is not 100% foolproof. Okay?
Will the mesh stays there for?
Yes.